If you are one of the millions of Americans struggling with some form of chronic pain, there is a good chance that your doctor has suggested a referral to a pain psychologist as part of your treatment. The first thing that most people do, however, in response to this sort of recommendation is to ask themselves, what is a pain psychologist? I will answer this question for you in this video. However, even more important than understanding what a pain psychologist does, many people underestimate how seeing a pain psychologist can help them because they've been taught some inaccurate ideas about what a pain psychologist can and cannot do for a condition such as chronic pain. For this reason, the second thing we will do in this video is to identify and dispel 3 common myths about pain psychology that could be holding you back from considering this highly beneficial treatment. First of all, what is a pain psychologist? A pain psychologist is a special type of clinical psychologist that has completed specialized training in pain management and that has experience working with people suffering from acute or chronic pain. If you have ever seen a child crying even before getting their flu shot, or watched an athlete bravely competing even while sick or injured, then you have seen examples of how much our experience of pain depends on our mental and emotional state. A pain psychologist doesn't replace your primary care physician or your pain doctor, but they can help you in ways beyond what your regular pain doctors do by teaching you ways to manage your pain through better thinking, coping behaviors, and emotional management skills. You might be surprised to learn that decades of research show that treatment by a pain psychologist works as well on average as most medicines or surgeries, with none of the side effects. Similarly, experts from the Center for Disease Control, the American Medical Association, and many other reputable sources recommend pain psychology as one of the most important treatments for people with chronic pain. Even for people that know what a pain psychologist does, they often decline a referral to pain psychology from their doctor because of one or more of the following 3 myths. Let's look at each of these 3 myths briefly and show why each is an idea that you should replace as swiftly as possible because they are probably preventing you from receiving the best possible treatment for your pain condition. The first myth is that many people believe that seeing a psychologist for their pain symptoms must mean that their pain is in their head. Even worse, maybe that is also what the person's own doctor thinks, and perhaps that is why they are referring them to the psychologist. While this is a common myth, it is the opposite of the truth. What is true is that your doctor knows that how much pain we experience and how much pain affects us depends partly on our psychology, meaning how we think, behave, and feel in regards to our pain symptoms. When a doctor refers a patient to a pain psychologist, it isn't because they think the patient is faking or crazy, but because they are confident that the pain psychologist can benefit the patient beyond their regular pain medicines and medical treatments. The second common myth that people have about pain psychology is that a psychologist could not possibly help with something like back pain, headaches, fibromyalgia, or arthritis. After all, how is talking to a psychologist going to help a person with pain symptoms resulting from a physical injury or a serious medical condition? One way of thinking about pain that challenges this myth is to consider how pain affects a person over time. When a person first suffers an injury, for example, this is what we call acute pain. During periods of acute pain, we typically seek medical attention, rest, take time off from work or regular responsibilities, and engage in other kinds of coping behaviors that promote healing and recovery. However, if the pain persists and becomes chronic, then these same coping behaviors actually begin to cause harm to the person. Too much rest, for example, results in weakness and disability. Too much time off from work and responsibilities results in financial stress and a loss of social contact. And finally, too much medical attention often results in expensive and unhelpful treatments, and even harmful side effects from pain medicines. This pattern is sometimes called the vicious cycle of chronic pain. It refers to the downward spiral effect of chronic pain, where it begins as a physical problem and gradually expands to become a problem that is physical, social, and psychological. The role of the pain psychologist in chronic pain is to help a person interrupt this vicious cycle with a focus on improving their overall quality of life. The third and final myth about pain psychology is that chronic pain has nothing to do with mental health. The widespread belief in this myth is one of the main reasons that people are confused and even afraid of seeing a psychologist as part of their treatment for pain. The truth is that chronic pain and mental health are very closely connected. Pain causes us to feel frustrated, angry, tense, discouraged, and worried, among many other emotions. When we hurt, we often retreat from social activities and isolate ourselves to a greater degree. We lose much of the enjoyment from activities and people that are usually a source of pleasure and meaning for us. Worst of all for many people, chronic pain causes them to feel weak, dependent on others, and even useless. Multiply these feelings and behaviors over months or even years of pain symptoms, and it shouldn't surprise you that chronic pain results in high rates of depression and anxiety. Suicidal thoughts are even common to people living with chronic pain when they begin to see their situation as hopeless or unbearable. Even though these are common reactions to chronic pain, they should not be ignored. The psychological consequences of pain can become big problems in themselves that require their own treatment. A pain psychologist can serve as an important member of the treatment team for the many people experiencing these secondary effects of pain and help them develop a whole person treatment approach that addresses the social and emotional challenges of chronic pain as part of their overall pain management program.